Hello, welcome to the introductory session for the paramedic analgesia comparing ketamine and morphine study. My name is Mike Smythe, I'm the Chief Investigator for the PACKMaN study, and this session will help you decide if you wish to participate in the study. PACKMaN is a blinded, randomised controlled trial. Essentially what that means is that the clinicians, patients and research staff will not know in advance which drug they are administering to the patient. You may be able to guess which drug has been given after administration, however you may well be wrong. The intention is that paramedics will deliver the intervention, and we will be comparing ketamine and morphine for the management of severe pain following trauma. The trial actually ends from the perspective of the clinician once the patient reaches hospital. We will be following up patients for outcome data after they're in hospital, but your involvement will end at the hospital door. There are several organisations and groups that have been involved in delivering the PACKMaN study. West Midlands Ambulance Service and Yorkshire Ambulance Service will be responsible for recruiting patients. Warwick University, where I work, are the sponsors of the study, but we also have co-applicants from Sheffield University and the University of Oxford. We have also involved a patient and public group in terms of the design of the study and the running of the study, and they will also assist with disseminating the research results. The study is being funded by the National Institute of Health Research, which is the research arm of the NHS. The PACKMaN study intends to answer the following question. Is ketamine superior to morphine for the management of acute severe pain from traumatic injury when treated by NHS paramedics? The primary outcome for the PACKMaN study is the sum of pain intensity difference score. That measures how much the pain score changes over time. There are a number of secondary outcomes that include the total pain relief or TOTPAS score, the patient-reported global impression of change, side effects and adverse events occurring in both ketamine and morphine arms, resources used, the cost effectiveness of each drug, and also longer-term outcomes such as chronic pain. To participate in the PACKMaN study, you need to be a HCPC registered paramedic. This is because the trial involves the administration of controlled drugs. The trial will be running at Hollymore, Erdington and Willenhall hubs. If you work at any of these hubs, we would like you to consider participating. In addition, if you intend to do overtime at any of these hubs, you will also be eligible to participate in the PACKMaN study. If you do choose to participate in the PACKMaN study, and we hope you do, this is what we will expect of you. When you attend a patient who has suffered an acute traumatic injury and that patient suffers severe pain, which is quantified as pain of 7 out of 10 or higher on the numeric rating scale, and you would normally be giving that patient morphine, then this patient group is likely to be the patient group we are interested in. We need to check that the patient meets both the inclusion criteria and that no exclusion criteria are present. If that is the case, then you would need to undertake a verbal consent process. This will not be a complex process. Essentially, it involves telling the patient that they may be eligible to participate in the trial. The trial involves giving them either ketamine or morphine, but we will not know which. The patient is then given the opportunity to say yes, they're happy to participate, or no, they don't wish to participate. If they choose no, then they get the normal treatment that you would provide, and in this case, that's likely to be morphine. If they say yes, then the patient is suitable to be enrolled in the trial, and they are randomised simply by opening the trial drug pack and giving the drug that is present within that pack. If you choose to participate in the PACKMaN study, then this is what we will expect of you. You must complete the trial training process and be signed off by the ambulance service to continue in the trial. You must manage the controlled drugs in the same way as you manage morphine. You must screen potential patients for eligibility. Those patients who are eligible, you must consent and give them the opportunity to opt out. If they are enrolled in the trial, then we expect you to randomise the patient by opening the study back and administering the enclosed drug. There are a number of processes that must be followed. You must administer the trial drug according to the protocol. This mirrors the gel count morphine protocol. Each drug pack has a wristband that must be applied to the patient. It's essential that this is applied as it contains both the pack number and the emergency unblinding number should it be required. When you get to hospital, you hand over your patient, advising the hospital staff that your patient has been enrolled in the PACKMaN study and point out the wristband, which includes both the PAC number and the emergency unblinding number should they require it. Manage your patient clinically. There is no change in usual practice. Monitor for side effects, and if necessary, you can treat those side effects. Thus, for example, if a patient became apneic, we would expect you to administer Narcan. There is a little bit of additional documentation, but we have tried to keep that to a minimum, and you must report any adverse events should they occur.